Dr. Matt Allen join us today so that we can learn more about patient engagement and teledentistry, among other things. So Matt, I'm going to turn it over to you.
All right. Well, thank you, Ashley. I appreciate it and excited to be with you all today. Thanks for taking your time over lunch or whatever it might be to join. Excited to share with you all today a little bit of what I have learned over the last year, especially, but probably even before that, around ways that we can use digital platforms to really increase patient engagement and make this not just a good experience for patients or something where it's like, oh yeah, that went fine, but something that they actually feel really, really good about. We want to make sure that we take into account any questions you might have as we're going along. So please feel free to put those into the chat. If there are things that we'll kind of address later, we might come back to those. Or we can certainly leave some time at the end for just an overall Q&A. So feel free to put them in the chat or hold them until the end. Whatever works good for you, that is totally fine with me. It's going to be a little bit of an interactive session just in terms of what we're going to be talking about. I will actually give you some demonstration on in terms of, hey, this is what it might look like if you do X, and here's how that's going to sound, and here's how that's going to feel. So you can actually not just think about that conceptually, but actually experience what that looks like, sounds like, feels like, etc. So with that, I will go ahead and share my screen here. We'll get started, and it's going to be fun. All right. So can everyone see that okay? If you can, thumbs up. Yeah, perfect. Thank you for the thumbs up. Appreciate it. It's good to see some faces as well. I know, sometimes this can be like speaking into the void, so it's always nice. Thank you for turning on your cameras, those of you who have. It's okay if you haven't, but appreciate those of you who have done that. So just a little bit about me, so you know whether to believe me or trust me, or take into account what I have to say with any sort of seriousness. I am the CEO and co-founder of Different Kind, which is a patient-focused digital health startup that helps people reimagine their dental experience. I'm the president and founder of MDavid.MI Inc., which helps dental professionals learn the styles and skills of motivational interviewing and shared decision making. I have done some consulting, still do, for DentaQuest Partnership for Oral Health, which I think is now called CareQuest Institute, as well as Elevate Oral Care. I am still a clinician at Clinica in Denver, and I am adjunct faculty at the University of Colorado School of Dental Medicine, as well as being a father of 3 young little boys who run around and cause lots of havoc. I do live in the mountains. I live up in Salida. So if you're ever up here, I know I saw Julie on the call. Julie's up here as well. So if you're ever up here, feel free. We would love to buy you a beer or take you on the river or something. So that is a little bit about me. Just a little bit about what we're going to talk about today and how we're going to use this time together. So first, I think I want to just conceptualize the shifting landscape that we all obviously see and feel every day. And I think as we get to this kind of post-COVID world of what is that new normal that I think we're all expecting will happen at some point, I think we're starting to get glimpses of that and feel a little bit of what that feels like, but want to kind of conceptualize that for us and imagine some things. We'll talk about the SHARE framework that we published last year in the British Dental Journal in Practice, how that applies to teledentistry, what it means, how we can best serve our patients in this digital platform world that we're all in. And then lastly, want to talk about the SHARE framework in daily practice. How do we take some of the workflows that we might already be using and actually apply those to teledentistry and what that really looks like. So those are kind of the 3 big buckets that we will cover today. And so to start off, really in this kind of change in a COVID and post-COVID world, I want to consider a few different things, and we'll look at a few different perspectives here. Ashley, before I do that as well, can you keep an eye on the chat just because I don't have it pulled up? So if there is any questions that come in, can you monitor that for me, please? Thank you. So before we dive into those perspectives, I want to think about this. I always love starting with this. This is obviously very informed by motivational interviewing, but On a scale from 0 to 10, where 0 is not comfortable at all and 10 is super comfortable, how comfortable are you, or maybe those you manage or whatever, at taking some of the bedside manner skills, maybe that's how you conceptualize it, motivational interviewing skills, whatever it might be, communication skills, and putting it into practice in a digital format? How comfortable do you feel doing that? Doesn't really matter where you are. It's, I think, just helpful for us to know where you're starting, so that when we get to the end, we can imagine, okay, how do we get to where we want to go? So if that's a 2, that's okay. If that's an 8, because you've been doing this a lot, that's fine too. Just make sure you kind of think about that number. You can think a little bit about why you feel that way. And we'll come back to this at the end. So keep that number in your head. All right, so let's go back to the idea then of looking at some of these different perspectives. And first I want to come to the idea with, easy for us to start with ourselves, I think, of understanding our role and understanding how that feels a lot of times in daily practice when we are seeing patients. And I think pre-COVID, a lot of dental professionals felt like surgical subspecialists. I am at my best when I am taking out a tooth, when I am doing a filling, when I am scraping a tooth, when I am filling a tooth, whatever that might be, right? Some level of my greatest skill set is my hand skills, and it is my clinical expertise in terms of taking that clinical expertise and putting that into play via essentially surgery. And I think a lot of dental professionals feel that way because for several reasons. Number one, that's how most people get paid the most, certainly. And number two, that's how most people are taught. I think in our dental education system, it puts a lot of emphasis on those surgical skills that we all need to learn as dental professionals. Not saying that those are unimportant at all, just saying that's kind of what we focus on, versus thinking about our role as a primary care provider. And really looking at our role as less of what I do with my hands and more of what I do with my brain, how I make diagnoses, how I think about things, how I talk to people. If any of you have ever seen the TV show Scrubs, if you remember that TV show, right? There's kind of the surgeon, internist divide that they experience, different color scrubs, all of those different things, right? And I think that pretty accurately represents in some ways what dental professionals have to be. They have to be a combination of both of those things. But I think when we consider our world in terms of teledentistry, obviously we are not really using those surgical subspecialty skills, and we're using more of our primary care provider skills. And for a lot of people, that's uncomfortable because they haven't spent as much time practicing those skills or feeling like that is their greatest skill set. So I think that's just important for us to recognize. And then with that, I think many dental professionals also feel like I am at my best when I'm doing the treatment, when I'm doing the thing, right? And again, going back to the show Scrubs, right? We see that, hey, there's a very real element to doing the thing, but then there's also a very real element to diagnosis and prevention. And again, I think that comes down to using our hands versus using our brain, just a kind of offshoot of what we talked about just a minute ago. And again, recognizing that when we are working in a digital space, that maybe we're using more of our diagnosis and prevention skills. And for many people, that might be somewhat underdeveloped because they have always just focused on the treatment portion of things. When I go to CE, I spend time thinking about treatment. I spend less time thinking about diagnosis and prevention. I'm not saying myself, but I think that that's what we hear. And I think even as far as how our EDRs are structured or our dental records are structured, right? Thinking about diagnostic coding, a lot of dental records don't have those kinds of things in it, right? And so you think about, well, does this tooth need a filling? It's like, yeah, well, why? Well, because there's a two-surface filling planned for it. And it's like, well, that's the treatment part. That's not the diagnosis part, right? So I think that there's lots of things that reinforce our thinking in this way, more towards treatment and less towards diagnosis and prevention. Again, helpful for us as we recognize why entering into teledentistry might feel awkward or feel like a challenge for people. And then lastly, to go along with that, I think a lot of people feel like those hand skills, their eyes, the visual tactile element of their daily job is their most important skill set versus the ability to listen and the ability to hear. Such an important skill in general, obviously, when it comes to communication, to listen well. We know patients want this, but I do think when you're sitting face to face with someone and you can essentially be like, hey, lean back and I'm going to touch your teeth and whatever, that you start to feel that that is more important than potentially when you're sitting face to face with someone and listening to the words that are coming out of their mouth. So all three of those things, I think, really just combine to make teledentistry challenging when we think about our role as dental professionals and dental providers of dental care for our patients. And then let's understand kind of our current cultural milieu, or our current cultural moment, if you want. Obviously, this has changed a ton during the pandemic, but it really, I don't think we'll ever go back to the same, because essentially patients now recognize, especially in the healthcare space, and I think that this is important for us to realize, right? We are a part of the overall healthcare space, but that medical care takes a large chunk of that. And so what patients are experiencing on a day-to-day basis is things like they can just go on buoy.com, they can find a symptom checker, they can, figure out why they're probably sick, they can talk immediately to someone virtually. That's all super easy. You could go do that right after this call. You could do it right now if you wanted to. If you're like, hey, that's more interesting to me than this. That's great. You can totally do that. And patients expect that. They expect now that they can have an experience like that. Or maybe when they actually go into a hospital or looking for care, that they can essentially use their app to find where they need to go, or they can find virtual care, or they can find an urgent care that's open right now, and they can schedule an appointment right now. When works for their schedule. They don't have to call an office. They can do all of that with technology, right? Or even when they go into the office, they can use an app like Abridge, which actually records your conversation with your medical professional, uses natural language processing to give you a transcript back, highlight the most important parts so you can remember what's going on, right? Patients are used to using technology now, especially, to interact with their medical care. And I think in dentistry, we've kind of always felt like, well, the technology is my CEREC machine, or the technology is my new, whatever piece of whatever new toy we might have, right? My new Diagnodent, or my new whatever it is. But unfortunately, those aren't patient facing. And I think patients now expect a lot more consumer focused technology to be used in dental practice, because that's what they've been used to in medical practice. And I think if we discount that, or if we don't pay attention to that, we are going to fall behind. Other people are certainly going to step into that space. And so we can and should do this. And so how do we do that really well? And then lastly, I just want to think about from the patient perspective a little bit. So we looked at it from the provider perspective. We looked at it from the kind of overall health system perspective. Let's look at it from our patient perspective. I joke with people often that I've spent the last 5 years trying to forget that I'm a dentist so I can really remember what it feels like to be a patient. I think that's a really important idea for us to consider when we're thinking about any of these new technologies or different ways of interacting with the technology that's available. This is not necessarily new technology, but I think that this is really important. And so this was a study that was done, came out in the Journal of Dental Research in January of 2020. And then I was actually in Liverpool right before the pandemic started, like the beginning of March. Had a chance to chat with one of the researchers and one of what are called the dental nurses, essentially dental assistants from this study. But what it really looked at was kids who were 5 to 7 years old, who were going into the hospital under general anesthesia to have an extraction. This is in the UK, so they're really doing this in a lot of Northwest England. Going in to have an extraction, so high caries risk. And what they did is, for one cohort of the kids, they had them talk to a dental nurse for a half an hour before they went in. And they did a lot of work around goal setting. So talking with the parents about what their goals for their kids' teeth were and how they might want to achieve those things. On the other cohort, they didn't have that conversation. They went in, they had the extraction. And they came back to both 2 years later after they had returned to their general dentist and looked at the numbers of new caries, et cetera. And they found almost a 50% risk reduction in the number of new caries for the kids who had had that one half-an-hour conversation with their parents, with the dental nurse. So an extraordinary reduction in caries risk rate, in caries rate based on one conversation. And I think for us, we feel like, oh, we want to do the best thing for our patients, and our patients want to prevent cavities. But the only way we can do that is by providing fluoride varnish or by doing some sort of treatment, et cetera, essentially providing some sort of chemotherapeutic intervention. But I think what this study shows really well is that simply by just talking with patients, and when you look at the write-up of that article, essentially they say, hey, there's this new talking intervention. And I think that that's a funny way of phrasing it, but essentially saying when we allowed the patients to be involved in choosing their own goals, figuring out what they wanted for their oral health, we were able to greatly reduce the numbers of caries in our patients. So if our patients want that, I think we need to be, and I think they do, right? I think we all know that. I think we need to be cognizant of the fact that it's not just those chemotherapeutic interventions that work. There are many other things that we can look to, like just talking with patients in a really effective way, using skills like motivational interviewing and shared decision making. And then when we look specifically at teledentistry, so 78% of patients, this was again before the pandemic, so interesting, said that they were likely to start using teledentistry in the next 5 years. I imagine this is even much higher now when you look at some of the studies that we'll make available through the resource packet that are available, just really high levels of, hey, I know that I'm going to do this. Actually, just before we jumped on this call, was looking at something, I think it was from Health Evolution, where even seniors over 65, 96% of them had some sort of virtual visit during the pandemic, right? And before that, it was almost impossible to get them to use technology to access, their medical care, and we're likely to continue doing it. So even for patients who may have historically been, reticent to use this kind of technology, now they've seen how it works and they're likely to keep using it. I would love for you guys to make some guesses here. What percentage of patients, this is from early pandemic, said that they would use teledentistry again after having tried it out? What do you think? Any ideas, any guesses? Feel free to put it in the chat. You can make your voice heard if you want to. Ashley, we got any answers in there?
We do. We have 50%, 60%, 85%.
Good. Those are good. All good guesses. 86%. So whoever said 85%, you were about right on. How many people would recommend teledentistry? You have any guesses on that? I'm guessing the numbers are probably higher for the guesses here.
50, 90.
90, okay. Cool. So about the same. 86% of people said, hey, once I've tried this, I would definitely recommend using it. I had a good experience doing it. I think that this is super interesting, right? Their concern was taken care of during their teledental visit. Almost 70% of patients reported that, hey, I had a concern and I was able to get it managed during a teledental visit, meaning that 31% of people didn't need in-office care following their teledental visit. So especially in the safety net where I work, in terms of working in a community health center, but I think anywhere in general, right? We want to be able to do what only we can do in the office. That's the idea of working to the top of our license and all of those things that we all want to do. And so we don't necessarily want to take up chair time for patients who don't need to be there. So this is a great way of helping patients get the care they need without having to come into the office at all. And especially for people who might be low caries risk, who might have a question, who might have something like that, they might not need to come into the office, more than once a year, more than once every 18 months, even in some cases. And this is a way to stay connected with those patients as well. So they want this care, they like this care. It helps with a lot of other systems that are going on in our office in terms of, hey, we don't want to have to see an LOE for a kid who just has a tooth growing in, right? We can take care of that via teledentistry. It's absolutely not a problem. All right. So then what does that mean? So we've kind of considered the provider perspective, we've considered the health system perspective, we've considered the patient perspective. How then do we take that and actually make this a good experience for patients? How do we take that and make it not something that feels like you're talking to, so I have a 6-year-old, a 4-year-old, and a 1-year-old. And obviously they've been FaceTiming with relatives throughout the course of the pandemic. And it's funny because I'll get the screenshots on my phone afterwards if I've let them hold it for a minute, of, you know, essentially half of their face, and that's all that's in the screen, right? How do we prevent our teledental visits from feeling like a 4-year-old is holding our phone, and it's, you know, you can't see, it's hard to hear what's going on, et cetera. And that's really why we developed this framework that we've termed the SHARE framework. How do we take some of the interpersonal skills we know from in our office that are important, and apply those to teledentistry settings? So we'll go through those. And again, this is where I'll give you all some idea of what this actually looks like, sounds like, feels like, via changing some of my camera, changing microphones, doing some of that stuff. So first of all, let's take a look at what the overall SHARE framework means and says. So if you read the email that you signed up for this, I'm sure you probably have seen this. If you read the paper, again, that's part of the resource packet as well that we'll make available. It's available for free on BDJ in Practice if you ever want it as well. But what do these things say? So the first S is kind of a twofer. Setting and speech matter. We'll come back to that and talk about why that is and what that looks like. We want to talk about holding eye contact by looking in the camera. Easy to say, much harder to do. Want to ask open-ended questions, obviously very informed by motivational interviewing. We want to relationally share information. Again, a framework here informed by motivational interviewing. But as we lose some of those ability to touch, see, and we have to rely more on listening, I think this is a critical framework for us to explore. And then lastly, express warmth and gratitude. What does it really look like for our patients to feel the empathy, feel the connection via a platform like Zoom that we're all on right now? So let's take a look at each of those pieces. So setting and speech matter. I'm going to stop sharing my camera or stop sharing my screen here. Going to share my camera. So right now you can see that I am in an office. Well, maybe you can't see I'm in an office. I am in an office, but you can see, you know, hey, there's like some symmetry to my screen, and, you know, I've got a light turned on back here and things look decent. We can see Ashley, she's got this, you know, nice little, you know, painting behind her head. I see some of you with even a virtual background, and that's all great. I also have a really nice digital camera that's running through something. So it's actually, you know, full on, it's not like the blur that's on the side of the screens here is fake. There are lots of ways that you can get pretty high end picture without actually spending a ton of money. Because, you know, what we want our patients to see is that it looks professional. It looks like, you know, I think it's become more common for people to take calls on the road or, you know, whatever, as we've all had a lot of life going on during the pandemic. But when we're having a healthcare encounter, right, we want it to look professional. We want it to look like someone has put some thought and care into the system. Right before I jumped on the call with you all, I went and I locked my door so that no one was going to come in and interrupt me, et cetera. It's a nice quiet space. There's no, you know, dump trucks outside or loud noises, things like that, right? Our patients want and expect that, just like they would be when we were in the office. And so some of this is, you know, important because we want our patients to look good. But one of the most important things, our patients can deal with a little bit of, hey, it doesn't look quite so good, or maybe, you know, the internet connection is a little crummy. And so it's maybe, you know, a little bit, obviously having a good one being hardwired in is important. But our patients can deal with some of that. What they can't really deal with is they can't deal with bad sound. Setting and speech matter. And so something that we really want to think about is how our patients are hearing us, even maybe more than how they're seeing us. So you can see right here, I have a little lapel mic. That's a USB mic that connects to my computer here so that you can hear me better. And in just a second, I'll kind of change some of these settings so you can see and feel what it sounds like when it's different. And so we just want to be thoughtful of that, even from the perspective of, okay, well, if I want to hear my patients really well and they want to see me really well, shouldn't I just use like the highest end, you know, type of stuff out there that, you know, gets a mic really close to my face? And so maybe you're thinking about something like this, you know, you use your good headphones and you're like, well, that's fine. But we should also just think about what that says to our patients, right? Are they going to think that I'm a DJ instead of a healthcare professional if I'm wearing really big, nice headphones or something like that, right? The reason that customer service people wear, you know, a nice headset like that with the mic here is you can't actually see them when they're talking to you. You don't really ever see anyone on TV with, you know, all of that stuff right around their face. So all of those things, play into how our patients perceive us when we're talking with them. So I'm going to change a couple settings real quick here. So I'm going to change to my screen that's in my computer. I think you can probably all see that's a lot worse, right? If this is the setting that I was talking to you now, same room, all the same things, just a different camera, that looks a lot worse. If we go back to the nice camera, oh, wow, now this looks a lot, more welcoming, looks a lot warmer, etc. Same thing with the microphone. So if we change the microphone, so right now I'm talking to you all through this. If I change the microphone just to the microphone that's built into, give it a second. Hopefully you can probably all hear that sounds a lot more tinny, a lot more hollow. It doesn't sound quite as deep, not quite like as real of a human voice. But if we go back to the nicer microphone, hopefully that sound comes back. You can start to hear that it sounds much more natural, much more normal. And this is not super high-end stuff, right? This microphone, I think, was $20. Or maybe it was 40, I don't know. It's not a ton of money, right? So as we're thinking about equipping our providers and our systems to do this really well, we might want to invest a little bit of capital up front to ensure that our patients can see us, can hear us really well, and that there's no confusion over any of that stuff. So, and again, thinking back to, what makes patients likely to have a bad experience, if I would encourage you to you can go on YouTube and watch these things. But there's something called the McGurk effect, where what we say and our lips moving, being synced to our voice is really important. And so if you've ever seen something where the audio is just a little bit off from the video, it can make a really big difference in terms of not only a patient just being like, I can't watch that, I can't look at the screen, but also I don't really understand, because patients will actually look at our mouth to understand a lot of what's happening as well. So we want both of those things to be really good.
Matt, we have one question in the chat from Julie about what kind of camera are you using?
Yeah, it's a great question. So I am using a Sony digital camera. And again, they make these like essentially from the gaming world. I'm not a gamer, but when I was getting all of my equipment, this is very common on Twitch and some of these platforms where they're showing themselves while they're gaming, which I don't know why you would need that, but apparently you do. So some of these devices are all kind of designed at gaming, and essentially allows you to have your digital camera be a webcam, because otherwise that can't happen. So I'm happy to send you all, or to put it in, we'll make sure we have in the resource packet as well, the setup that I use in terms of camera, lens, all of the different things that I have and use to get a good quality picture and get a good quality sound. So, okay. Great. And you might be saying, well, why are we talking so much about logistics? This is technical setup stuff, right? And it is in some way, but I think we've all just experienced those moments where, if the room is really dark and you can't see someone or you can't hear someone quite so well, it just kind of feels like the stuff that, is important. It's like setting the table, right? If you just, made this beautiful meal and then went and dumped it all out on the table, people are like, what are you doing? You spent all this time, developing this clinical expertise and working on your communication skills and whatever, only to have your tech setup let you down so that you can't see and hear the person that you're supposed to be talking with, or they can't see you. Kind of feels like the stuff that comes before what we really want to do, but we can't not focus on it. All right. And so then the H there in the share framework is hold eye contact by looking at the camera. And so, like I said, much easier to say than it is to do. And so instead of going back to my screen, I'm just going to stay here with you all. So my computer right now is this way, just down and to the right a little bit. I have it propped up a little bit on my desk so that it's a little bit closer. But you can see that if I'm looking at my computer and talking with you all, I'm looking at the chat, I'm looking at who's here, I'm looking at your faces on my screen. It actually doesn't really look like I'm looking at you now, right? I'm looking somewhere else. And that's the hard part about visits like this, right? Because essentially, we want eye contact. We know that eye contact is important for creating trust, for showing empathy, for doing all of those things that we do naturally in our office or when we're working with patients. Unfortunately, when we're doing that essentially, in front of a camera, we can't look at other places, or it makes it a lot harder to look at other places. So what I encourage people to do, essentially, to be able to have this kind of eye contact where I'm looking at you, where I'm connected to you, even if that's just by looking, into a lens, is a couple things. Number one is just practice, right? I think that for a lot of us, obviously the pandemic has helped us become more comfortable. But it's just like when you're taking a family picture or something like that, right? And it's like, no, like the kids are all running around. You're like, no, look right here. Like look at the lens. We just need some practice to be able to do this really well. And there are other things that we can do to help kind of make that a little bit easier as we start to practice. So number one would be to try to put your computer as close to your lens as possible. So they make those weird kind of, things that hold your, webcam or whatever you might be using, so that you can align it. You can raise your computer so that it is, on top of books, or they make stands or whatever it is. Mine is sitting on top of Motivational Interviewing in Diabetes Care, The Lost Art of Healing, Judeo-Christian Perspectives on Psychology, Nutrition and Physical Degeneration by Weston Price, which is a fantastic dental book if you have never read that. So that's what my computer is sitting on right now, right? But the nice part is you can't see that, so it doesn't really matter. But does help to get your computer up. So that would be one thing. Number two would be to tell your patient if you're going to look off the screen. I think this is always helpful, even if you're not talking with a patient, if you're just on a Zoom meeting or something, of like, hey, I'm going to just be taking some notes, or I'm pulling up your radiographs. If I have to do something on my computer, I want to actually let you know, so that you can say, oh yeah, that makes sense. And then number three, I think it's easier, or we want to look at someone when they're talking to us. And so the third piece would be to, while you're speaking, try to look directly into the camera. That's a really important time, I think, to look into the camera. And then if your patient's going to speak, but is responding to you, and you want to see, what they're doing, what they're saying, et cetera, and you need to kind of look somewhere else, that's an okay time to do that. And again, just let them know, hey, like when you're talking to me, I'm going to make sure I'm looking, at you, but that means looking at my computer screen. So just a few small tips to help you get used to that process, what it looks like, feels like, sounds like, et cetera. So for much of the pandemic, obviously, I've been doing this kind of work, and it feels like all day I'm just staring directly into my lens that's sitting on top of my desk, and I actually get less experience looking at the people I'm talking to. But that's part of that is okay, because again, for our patients, we want to make sure that they feel like we're focused on them, looking at them, creating that eye contact that's so important. Great. I'm gonna go back, share my screen again here. So that's the S and the H. Setting in speech matter, hold eye contact by looking at the camera. A, we come to ask open-ended questions. And again, this is obviously informed by motivational interviewing. And as we've been actually working on redesigning some of the Cavity Free at 3 curriculum, we've been kind of trying to take some of these skills and put that into there as well, so that we can do this all over the place, right? So whether it's a teledentistry framework or Cavity Free at 3 or wherever it is, how can we take these skills that we know are important and actually bake them into all of our standard workflows? So things like that we might ask a patient on a teledentistry call: what is your chief complaint? I think we all get taught this at some point. You have to address this. It doesn't have to be done, even though this is an open-ended question. It's kind of jargony, not all that helpful. What if we said, what matters most for you to cover today, or for you to talk about with me today? Right? That's just such a more conversational way of phrasing that same thing. We're still going to probably chart into our notes, patient's chief complaint was X, but we don't have to say those specific words. Something like, do you have any questions? Not an open-ended question here, obviously closed-ended. And especially, this is something that our patients will take as, well, this is time for me to be done, because this is the social cue has been set of, no, I'm not supposed to have any questions, and now it's time for this call to end, right? But what if we said, what if any questions might I be able to answer for you? Now that actually sounds like I care. Now that sounds like I want to listen to those questions. Instead of saying, well, do you have any questions? Oh, no, okay, cool, it's time for me to go, right? But no, like, what if any questions can I help answer for you? Even if it's said at the same time of the conversation, totally different feel. And lastly, something like, oops, sorry, went the wrong way. And I do have a clicker here. I also, if you do have some like a presentation to walk through with your patients or whatever, it just helps, especially as we're talking about holding eye contact. I'm not looking over here. I'm not leaning over trying to find the right buttons. I'm still using my clicker just like I would in any sort of normal presentation. Where does it hurt, right? This is, I think, again, as I think back to being a dental student, it's like, well, okay, I got to know that. So I have to know where they're having pain or whatever. And there's lots of closed-ended ways that we can ask a question like this. But tell me about what's been bothering you, right? Now I'm looking for story instead of location. Now I'm looking for the whole picture instead of one small part of it, right? I'm able to get a lot more information from one question instead of having to ask 4 or 5 closed-ended questions. And so especially if we're thinking about using teledentistry for more kind of emergency type of care, we want to triage patients, we want to help understand what we might need to do in the office. Something like that can be really effective in terms of helping the patient have their story be heard, which again, we know is really important for patient satisfaction. So 3 examples, you all can come up with many more, but really thinking through, okay, if we do need to listen to our patients and that's going to be important, how do we actually enable them to speak? And one of those ways is going to not be by asking closed-ended questions and doing it with curiosity and genuine concern for what's happening. So relationally share information, the R of the SHARE framework. What does that really look like? What does that mean? And if you're familiar with motivational interviewing, you might be familiar with the framework EPE, or elicit, provide, elicit. Again, to me, that sounds kind of jargony, which, as we just saw, we want to avoid using jargon, whether that's helping people learn about motivational interviewing or whether that is helping our patients learn about their oral health. So I like what essentially one of my mentors has rephrased it as a explore, offer, explore. So when we need to share information with our patients, this is a really great way of doing so in a way that still promotes conversation and doesn't feel like a lecture for our patients. So what does that really mean? Well, the first explore, when you know one of the most disengaging things we can probably do with our patients is share information with them that they already know. And so the first explore is really to find out what they do know. Hey, I'd love to share some information with you on cavities or on periodontal disease, gum disease. Is it okay if I do that, right? And so what do you know about that is really where I want to start. Now I can tailor whatever information I have to share to where you're currently at. When I offer, I'm going to share some information. It's going to be a small bite-sized piece of information. It's not going to be, a long diatribe. It's going to be bite-sized, going to be jargon-free, going to be tailored to what you need to know. And then lastly, I'm going to, and probably most importantly, I'm going to re-invite you back into the conversation by asking what you think about the information I shared. So I might say something like, so what do you think about, what I just shared with you? Or I wonder what your reaction to that piece of information I just shared with you was. Something like that invites them back into the conversation. So I might be doing this with a type of treatment. So, hey, we can, put sealants on your kids' teeth. What do you know about sealants? Well, yeah, I've had 4 kids and most of them had sealants. Oh, okay, cool. So you probably know a little bit, yeah, right? I share some information. Yeah, so what do you think about that? And oftentimes what I'll hear in those situations is, yeah, that sounds great. I want to do it, right? And now they're the ones saying, hey, this is what I want, right? This is our treatment plan moving forward. And they're the ones voicing that. So a lot of times it comes to that, or they might have questions, right? Again, we want to invite those questions. And so, hey, what do you think about that? Well, I have a question here. Great, let's talk about that. People are much clearer when we reinvite them back into the conversation after sharing information with them. And lastly, we come to the E, express warmth and gratitude. There's lots of great studies out there that show that even if you're just picking up the phone, right, and you smile before you actually call someone or talk to someone, that they can feel that difference if you smile or don't smile, or smiling on the phone, which I think is fascinating. But lots of really great research here to show that our bedside manner, our compassion, our empathy really does translate when it comes to digital care, and patients can feel that. They can feel if we're just trying to get off the phone or we're just trying to get off the screen, et cetera. And so we want to express warmth and gratitude. We want to help them understand. This might be their very first, visit ever via a platform like this, and we might be doing it all the time, every day. We want to say, hey, thank you for trying this. We really want to meet you where you're at. We know that this is one of the ways we can do that. Thanks for jumping on this call with me. I know it's a little bit weird, but we're so glad to still be able to connect with you in this way. And hopefully it helps saves you a visit, right? Or having to take time off of work or whatever that might be. So still expressing all of that warmth and gratitude in very clear-cut ways, I think can be really helpful for our patients to feel like, wow, that was a really great experience. I'm really glad I did that, instead of, well, yeah, that checked a box, but it didn't, I'd rather go into the office, right? So SHARE, one more time for us all here: setting in speech matter, hold eye contact by looking at the camera, ask open-ended questions, relationally share information, and finally express warmth and gratitude. You will all have access to these slides. We did make a video that shows some of this in a little bit more interactive and fun format. If you don't want to read the paper, it's on YouTube. You can look at it there. It shows some of this, an example of, hey, here's what not to do, and here's how maybe to do that better. So that is available as well, and as part of the resource packet that we have too. All right, so what does this really look like then in practice, right? How do we do some of this work? How do we help patients set goals? How do we get the information that they want? All the things that we've been talking about. And so we've thought about some kind of specific workflows that happen in dentistry that we wanted to share with you all as well. So this is one. I'm sure you've probably all seen self-management goal menus. Cavity Free at 3 has a great one. This is one that we developed that actually is maybe a little bit more specifically for teledentistry, because maybe there is some ability for us to say, hey, look, we can stay connected to you every 6 months, every year via teledentistry. We can have a check-in, and that might be a goal that a patient wants to choose, right? And so we thought a little bit specifically about how teledentistry might fit into some patient goals that actually do promote oral health. So again, this is in the resource packet. If it's helpful for you, you can use it on the screen like this, right? To say, hey, here are some things that people have tended to do. Even right now during the pandemic, if you're not feeling comfortable coming in or whatever it might be, what's interesting to you, right? And they're like, oh, well, yeah, I would love to stay connected via teledentistry every 6 months. Cool, we can totally do that. We can have those check-in touch points, et cetera. Maybe it's a kid who's high risk and we can touch base every month because we know that it's not necessarily going to be applying fluoride varnish, but it is important for us to have a touch point with them much more frequently than once every 6 months. We also created, I know I see several virtual backgrounds. Julie, I see you're standing in the tall grass somewhere. We did, if you like virtual backgrounds, I tend to not like to use virtual backgrounds because to me, it feels like I'd rather just be in the place where I am. But if you do like those, we said, great, let's kind of take that self-management goal menu concept and actually apply it to this. And let's put some of those things on there so we can say, hey, here on the right side of what you see behind me are some things that can tend to help keep you healthy, even right now during the pandemic, while might not be able to come in, or you don't want to come in, or whatever it is, what's interesting to you right over here, right? We can have that conversation just by having that virtual background behind us. So all of those are available as well. There's the kind of home and office preventive care. There's also a food and kind of beverage one as well. So if you're want to choose and be specific about that, you can do that. So just some resources for you all to, if you're interested in those, to take some of our workflows. Hey, we used to do this in office. We would have these self-management goal conversations. We would talk about it. And now that's a little bit harder. So how can we take some of those workflows and actually make them digital friendly? So we've done a few of those things for you. In the resource packet as well, there is probably things that some of you have seen as well in terms of white papers on teledentistry and all of the many other pieces that kind of go in, and all the research that's been done on teledentistry since the pandemic has started. So if you need any of that data, that should all be available to you there as well. We've tried to kind of put together a lot of what we've worked on over the past 15 months or so, and said, how can we kind of tell a story here through these resources? So if you need any more, obviously there are plenty more. Happy to direct you to more as well, but we didn't want to overwhelm you with too many either. So coming back to this then, on a scale from 0 to 10, where 0 is not comfortable at all and 10 is super comfortable, how comfortable do you feel applying some of the same things that you do in office to show empathy and compassion and all that stuff, doing that digitally? So we started off there. Now my question for you now is, what would it take to move you 1 to 2 numbers higher? So what would it take for you If you were started at a 3, what would it take to move you to a 4 or 5? What do you want to practice? What do you want to learn? Or what do you want to put into practice from what we've learned today? Hopefully there are some things here you feel like, oh yeah, I can do that. That would probably help me. So would encourage you all, love you all to think about that in terms of how you are going to become more confident in practicing these skills digitally. Maybe it's moving your computer up closer to your camera. Maybe it's looking at the template of, hey, here's all the things that's going to take me to use this with my patients, digital camera, whatever it might be. Maybe it's just asking open-ended questions. That's great. I love that. So think about that as we finish our time together today. Here's my email. You can also, that video that I was mentioning, I think that's on my website as well. You can always access it there. There are other motivational interviewing videos there if you've never seen those and want to see what it looks like, sounds like to do motivational interviewing in a dental setting. With that, I will say thank you very much for joining and open it up to some questions. We have about 10 minutes. Want to give us time to have a bit of a conversation and hear from you all. Maybe you've been practicing this. You're like, oh yeah, that would make sense. This is challenging. What would you recommend for this? Whatever. I'm here. Let's chat. Teresa, I think, is saying she's at a 10 now. She's feeling really good about using some of these skills in a digital format. That's awesome. Feel free to unmute yourself. Would love to hear your voice. And if not, feel free to chat in.
Hi, Matt. I have a question. How do you, I don't get the digital camera. Like, is it sitting on top of your computer with your screen up on your laptop?
It's kind of sitting next, like I said, here, let me pull it up. I think I can have it for you in just a second here. Let's see, where is it? It also doesn't have to be a digital camera because I know that that's more expensive, right? Compared to some of the other things. So it could simply be, a regular webcam. But I always encourage people, whatever is built into your computer is generally not of very good quality.
Right.
And so getting something else that is not that is probably helpful. So yeah, that would be my encouragement. I'm not seeing it right now. I know I have it somewhere, but I don't see it. Oh wait, hold on. I know where I used it last. Now I can't find the folder.
Oh, that's okay.
Yeah, I'll share it with you all so that you can see. But essentially I have kind of something that clamps to my desk that's holding, it's not a tripod at all, but kind of just like a clamp that sits on my desk. And then that holds the digital camera and then my computer.
And your computer's like right next to it.
Right next to it, yep.
Okay.
Yep.
Thank you.
No, totally. It is. I think it's really helpful especially if you're doing it all the time, right? For me, as I was like, I have to live this out. If I'm teaching people that how I look on camera is important, I should probably give them a good example. And so, went out and figured all this stuff, and it's like, how to Zoom like a boss, right? How to Zoom like a CEO, and you're like, all right, cool. But it doesn't really take that much once you get down to it, and it is really helpful.
Yeah, it makes a big difference, I think.
I think so too.
If I'm looking at my camera on my laptop, I'm getting distracted by the stuff that's on my laptop. Yeah.
Also very true. Exactly. Yeah, that's another piece. Obviously we all have, you have the entirety of the information that's ever been created by humans, right? With one click on your, on your computer. And so it actually is kind of helpful to kind of focus, because now I'm not looking at my computer. I'm just looking like you are hanging out right now, Julie, right? Like we're together. So.
Right. Yeah. Cause I was trying to do that and I noticed I just kept looking down at what was going on the screen. So.
Exactly. There you go. Yeah. I'll make sure that we have that in the resource packet. I have a slide that has all the things in there with a picture so you can see what it is.
Oh, great. Thank you.
Yeah, no problem. What other questions might you all have? Put a smiley face sticker where your camera is. I like that, Teresa.
I do have one question.
Mhm.
I'm just wondering if you have any tips or anything you'd adjust for teledental that includes kids, especially young kids. I'm thinking about kind of cavity-free at 3 age range or even school age.
Yeah, I think that's a great question. And obviously in a situation like that, so you saw a virtual background, in terms of talking about self-management goals. I mean, if you're talking with especially a really young kid, you're probably talking with the parents, so you probably don't need, the fun, like how you might design your office, right? Of lots of bright colors and total, pediatric friendly office, if that's what you would do, especially if you're talking to the parent. So I would say one of the biggest things that I think just is helpful though, from that perspective, as we talk with kids, is that we actually get a peek inside of our patients' homes as we're talking with them potentially, right? So if we're having a conversation with them about a self-management goal, and we can say, oh, so you want to brush your teeth. Can you show me like where you keep your toothbrush right now? In the past, a patient would have to say, well, yeah, I keep it in this drawer that's down here or whatever, right? And now they can like walk into their bathroom and be like, hey, this is where I keep it. It's over here and this, or whatever. So I don't think that's maybe that is a tip, right? Is to say, hey, take advantage of the fact that you have this special, unique glimpse into your patient's home and can maybe help troubleshoot or see some of what they actually have going on that might be creating some challenges for them, as you think to work with them of how you can overcome those challenges. And that's obviously a huge gift, so that would also then be a like express gratitude piece, right? Of thank you for inviting me into your home. I know that this feels weird, blah blah blah, but it's really a privilege to be able to speak with you in a place where you feel comfortable. And then also taking advantage of the fact that we can, the kids aren't going to smell, see all the bad things that might be associated with the dental office, I would say is a huge advantage. And so, especially for people who are scared, or who as parents who are scared, who might have some of those negative associations, to take advantage of teledentistry as much as you can, because I think that we underestimate, for a lot of people, it's just the sights, the sounds, the smells, that really do trigger those things for them. And so using that as an opportunity, instead of, this is something we have to do, right? It's like, no, now we have this opportunity to connect with you via teledentistry and have good conversations while you're not experiencing all this fear. So those would be 3 things that I guess I would think about, at least initially, in terms of, creating some good engagement and using teledentistry to the maximal effect for younger patients. Easy to ask the patient what works best for their child. Perfect. And I certainly would put that out to all you all as well. What things have you found to be most helpful when doing this, maybe with kids in a cavity-free at 3 type of setting? What have you found to be helpful? Would love to hear from you all as well. Feel free to chat in. Feel free to make your voice heard here. What other questions might I be able to answer as well, if no one wants to share? Sounds good. We're about right at time. So want to, again, thank you all for joining. What we will do is make sure that you have access to download all of the tools, download the kind of resource guide and packets that we've put together for you. And maybe that's just helpful for sharing with other people. You might totally be aware of all of those resources, but you kind of want something to be able to give to others when they're asking about, hey, how do I get my office set up for teledentistry, or what do I think about? We'll make that all easily available to you so you can download that. Want to thank you all for, again, just taking the time. I know that Zoom fatigue is a real thing. So thanks for joining me over your lunch hour. Ashley, is there any closing logistics that you want to share?
No, that's all. We will be emailing you all with the resources as well as the recording. And so just let us know if you have any questions. And you can obviously reach out to Dr. Allen as well, because his contact information will be included.
Or Julie, you can just come knock on my door. So.
There is one more thing. We were hoping to have a couple follow-up, just lunchtime, open for kind of a community of practice, or to bring additional questions. So as you start to try out some things over the next couple weeks, we will have some times available that we'll send out as well, that you can join us and Dr. Allen and ask some questions, or just engage in dialogue about this topic.
Or any other topic that you might want to talk about. We're happy to provide an open forum and be a resource in a time when that's certainly needed. So yeah, we'll be here for you. Keep an eye out for more information on that. Cool. Well, thank you all. Really appreciate it. Great to see you. Come say hi if you're up in Salida or Buena Vista. Would love to, like I said, get on the river with you or buy you a beer or coffee or something like that. So have a wonderful day. We'll see y'all soon.